on Paramedics Emergency Response.
Got a headache?
Feels like something smashed me inside of my head.
Can you squeeze my hand?
We're CTAS 2 or stroke alert. 29.9. A temperature of 29.9 Celsius is way too cold.
Oh my God, he is frozen.
You've been throwing up like this for this long.
This is serious. People can die from bleeding within their GI tract.
That's so rough.
Nothing like hitting the ground running, eh?
Hitting the ground running.
Base to 67, responding for a 53-year-old male patient having stroke-like symptoms. Patient describing a sudden facial droop, not completely alert. Patient is a street sweeper, was found outside of his vehicle. You'll see the street sweeper at the side of the road, patient in uniform.
196724. If this is a true stroke, then the patient needs to be at the hospital as quick as possible. We have a window of opportunity to correct the problem that he's experiencing.
It's probably legit stroke, I would think.
There's a cop car straight up ahead if you can see the flash. As we pull up on scene, we can see the street cleaners pulled over on the side of the road. There's a lot of activity going on, and all of the employees looked very concerned. Okay.
Hey. Good. What's going on?
He's got numbness in his shoulders and tightness in his chest.
Yeah.
You can see he's got his mouth is loose. He's having a hard time speaking.
Hi there.
Right.
Hey, how you feeling?
Got a headache.
Got a headache?
I did.
You did have a headache?
Yeah, I still do.
Do you? Okay. Which side of your head is the headache on?
Feels like something smashed me inside of my head.
Can you squeeze my hand?
Yeah,
This one.
yeah.
You move this leg? Can't move it?
Everything feels tight.
Yeah, okay.
We're CTAS 2 going to university for stroke alert. Hey guys, who found him? What time was that?
15 minutes ago.
Okay, what time was he seen normal last?
20 minutes ago.
We're gonna pick you up and put you on our bed, okay?
With any type of stroke, time is of the essence. We need to get him loaded as quickly as we can. I'm gonna sit you up here, and I'm gonna come in behind you. Okay. 1, 2, 3.
We do an assessment called FAST: face, arm, speech, and time.
Good job. I'm gonna keep holding you there for a sec.
F, face. We look at his facial droop, which he has.
I'm gonna keep holding you there for a sec.
Arms, he can move one arm and not the other.
Is one eye better than the other?
S, he has garbled speech.
Everything's blurry.
Everything's blurry.
And the time is the crucial factor in a stroke assessment
Do you wanna hop in and hold that arm up?
to determine when he was last seen normal.
We're gonna take you to the hospital. We're gonna get a scan of your head, okay? Okay, you got something going on inside your head. 151 and 94. You're okay, partner. We're gonna take good care of you.
It is fortunate that he was with others who recognized the signs and symptoms of a stroke and called 911. We need to leave right now, and we're going to transport as fast as we possibly can.
Before 1936. Reporting an adult after a 50-year-old male. He's having difficulty breathing. Fire to the on scene.
Divert. At this point, the information's still a little vague. We have to be prepared for anything.
Nothing. No new details anyway. Sick.
60-year-old male with shortness of breath. That's a pretty common chief complaint, but it doesn't really give us a lot of information.
What are we here for?
We arrive on scene, and there's a security guard telling us this patient is unconscious. This is slightly conflicting to what our initial info was. We walk in, it's extremely tight quarters.
Holy smokes.
And there's an excessive amount of bloody vomit everywhere.
Thank you.
There's dirty needles, there's empty alcohol containers,
Here, I gotta check you out.
and this patient is clutching a bottle of vodka.
So you have pain in your belly right now? How long have you been feeling like this for?
2 o'clock yesterday.
2 p.m.? Oh, you've been throwing up like this for this long.
We see this dark, tarry vomit on the floor. This is the result of blood from this patient's GI tract.
Here,
That's something else.
straighten your arms.
This is serious. People can die from bleeding within their GI tract.
We just gotta check your blood pressure here. Can you straighten your arm?
We were just checking out the building, and I found that the door was propped open with the garbage bin there, so I knocked on the door.
Any drugs or alcohol? Alcohol, how much?
1 liter yesterday. I asked him what's going on, and then he started calling for help.
There's a bunch of rigs there.
We can see there's drug use within this apartment, but I don't believe that's this patient's primary concern right now. I would suspect that years of alcoholism have contributed to his current state.
Your blood pressure is, well, kind of like what we expected, because I think you are bleeding. So we're gonna have to run you up to the hospital. All right, let's sit up here, my friend.
It's too bad this patient had to be here all alone for so long while he's been so sick.
Got it? Yep.
This patient has a gastrointestinal bleed.
Christian, so far all I find is Tylenol.
He's gonna have to make some lifestyle changes to prevent this from reoccurring.
What kind of drugs do you use?
So yeah, he's pretty sick. He's been vomiting like that probably for a couple of days. Says he's been a drink or two.
How come you didn't use today? You were just feeling too unwell?
Go work, they'll get his blood pressure up a bit before they get to the hospital, and hopefully his hemoglobin levels check out once we get there.
This is a Bravo response. City police are on scene. 20-year-old male who has been tasered.
1967 copies that info.
Call comes in, 20-year-old male taser. I'm thinking, wow, what has this guy done that he's been tasered by the police?
So we went for a Taser Tuesday.
Nothing like a good set of prongs in your buttocks on a Friday morning at 4 a.m.
It's standard police procedure that any time someone's tased, they either be checked out by EMS or transported to the hospital. How we doing?
Taser deployed. Guy got full NMI and cracked his head on the concrete. He's complaining of anything real serious, but
He's in the police car already, so they've moved him. And upon asking the police officer what occurred, he informed me that the guy tried to get into the apartment building, wasn't able to access the door, and that's when they tased him and he fell backwards onto the ground.
Just bring the stretcher over here.
When I first see the patient, he's really out of it.
It's pretty intox or what?
Which leads me to believe he's intoxicated.
You stand? Come on. Have a seat on that bed.
We always have to make sure that we use precautions. We have him handcuffed, we have him belted to the stretcher, we have the police officer as an added precaution.
So this young man robbed a business establishment down the block. Foot chase ensued with the city police. They tasered him. He went down. He's exhibiting signs of extreme intoxication and probably high on drugs of some sort.
All right, let's check this guy out.
We got him in the back. He's nice and safe now. The barbs have been removed and we're just gonna take care of him.
Looks like he fell in his knuckle or did something here. See it bleed?
Got a good gouge.
Yeah.
The fact that this guy is in as good a shape as he is after armed robbery and running away from the police shows tremendous professionalism on our police department.
Yeah. It's fine. Hi.
How you doing? This patient is so inconsistent with his mentation.
Put your head back. There you go, right there. Right there.
That we're putting a C-collar on him as an added precaution.
It's just a collar. It's temporary, buddy. Just till we get your neck looked at.
You know, we treat everybody the same, and it doesn't matter what they've done.
No, man. I'm trying to relax.
It could have been far worse. He could have been shot. He could have been killed tonight.
Hey.
No, not him.
Citizen murder.
I know you are, so am I.
So I'm hoping that
We're all citizens.
once he sobers up, he'll realize his mistakes and never do it again.
Listen to me. We're gonna put this mask on your face, and it's got a very high level of oxygen, and it pushes it in your lungs, okay?
Sally's one of the best paramedics around.
Big breaths. You're doing really good.
It's very rare a shift will go by where she can't teach me something or there's something that she doesn't know.
Does it feel better? Yeah?
She's easygoing. She's positive.
That mask is really helping, hey? Yeah, good.
And she always comes to work with the right attitude.
I'm glad we tried it.
Question 1936, this is an alpha response for a 50-year-old male having seizure activity.
10-4.
I think I know who this is.
10-4.
Call comes in for a 50-year-old male with seizure activity, but I recognize the address, and this is someone we respond to quite frequently.
Lives on the top floor of that corner apartment building.
This poor guy is in really bad shape, and I'm not sure why he solicits our help so frequently, because ultimately, he never wants it.
1967 to base. We're just having difficulty gaining entry.
10-4-1901, St. Paul.
There he is.
We know going in that this patient is an alcoholic.
Yeah, he's making his way.
And he's typically not receptive to our treatment.
How's he gonna get back up?
This patient used to be an addictions counselor.
Hi, Doug. How are you doing?
And now, addictions have robbed him of his career.
So what's happening tonight? Alcohol is the problem.
Pass your hand out here, Doug. I gotta check your blood pressure.
When was your last drink?
20 seconds ago. I took a sip before I came downstairs.
Okay. We get called when people are sick. We get called when people are scared. But in Doug's case, I think he calls us because he's alone and he doesn't know what else to do.
I can't function. I can't walk. If I stay here, I'll keep drinking. There's no stopping.
People drink because they think it will help with their problems, but in reality, it only causes more.
Have you been going to meetings?
That doesn't.
I'm just wondering if the hospital is the best place for you, or if maybe like brief detox is an option.
With this type of addiction, it's really hard for us to help him until he's ready to help himself.
Okay, well, you don't like it, that's fine, we won't take you there.
We can't force him to get help. We can offer him help, but he has to take some responsibility in this as well.
Oh, unless I go back up and drink, because you're not up with me.
We've had this exact conversation with him many times before.
Okay, well, sir.
He says he wants help, but then he's not willing to accept the help that is offered.
Doug, are you gonna be okay making it upstairs to your room?
Alcoholism is a real problem. And it's difficult to see people living in this state.
The Larson house, I personally think is the best spot for him. Right, he's worried if he goes upstairs, he's gonna keep drinking.
It's a vicious cycle.
Yeah, it is.
It's the same with any addiction, doesn't matter what it is. 2.5 years straight. Now I'm going bankrupt because of alcohol.
Pulse. Get on the stretcher.
Get on the radio, tell them we're C-Task 1.
I think having a good partner is essential.
You spend 12 hours a day, 5 days a week with that same person. Yeah, this one right here.
You need to be able to count on them and trust them.
Adrenaline is going 100 miles an hour. You're solving problems.
Ready? Yep, 1, 2, 3, slide.
And a lot of times you don't even need to speak things out loud and you just get it and understand each other.
What do you think the night's gonna bring us tonight?
I don't know, we're gonna see. We're gonna see how the night goes.
Peace and hippiness, brother. Carver's peace and hippiness? Yeah.
Dates 1967. Delta response. Call for a man down. Unknown consciousness and breathing status. You'll find your patient laying on the sidewalk beside his bicycle.
1967 copies.
So a call comes in, guy laying beside his bicycle. I'm thinking, did he get hit by a car? Is he intoxicated? Is he on drugs?
Right there where the big fire truck is.
I think that's a safe bet. As we arrive on scene, police and fire are already helping the patient towards us. We are 21. How are we doing?
He's fine, but he said he's
just cold. But
Let's take him inside.
If you're cold, we're gonna get you warm.
Here, it's a nice warm.
We need to get this patient into the ambulance fairly quickly to get him warmed up.
Right up here, yeah. Good stuff, good stuff. Okay, let's sit you down on that green thing.
Take your coat off.
How long you been outside? Here, you can sit right down. We got the heat cranked up. How long you been outside for?
Perfect. Thank you, fellas.
29.9.
Huh?
29.9? A temperature of 29.9 Celsius is way too cold. He should be around 36.6.
We'll warm you up.
Oh, it's soaked.
Why are you so wet?
I don't know, it's cold, that's all, man.
We understand you're cold, but why is your shirt all wet?
Okay, what did you take tonight? What did you take tonight?
Boy, he's like... Look at him tweaking.
All of a sudden, the patient goes unresponsive.
Okay, now check his pupils.
He's got some track marks, sir. This really heightens our suspicion that this guy's got some drugs on board.
1, 2, 3.
Get him out of 2.
Hang on, buddy.
Yep.
Let's get him out of his pants.
Do that.
He's frozen.
Yeah.
What the hell's in his pocket? I don't trust what's in his pocket.
Okay, man, we got the heat coming.
I'm not sticking my hands in there.
How you doing, man?
Money? What in the hell? Teeth.
Just gonna recheck
Oh,
his
wait,
pressure.
wait. Here we go.
Is that red heroin again?
The baggie that we pull out of his pocket could be anything. It could be crystal meth, it could be heroin. But because he's unconscious, I believe that whatever's in the bag is caused.
How cold is he?
He was 29.9 when I checked him initially.
So our patient's temp isn't coming up and he's really cold. And there is no real way to warm people in the ambulance.
Trying to put a hot pack between his feet.
I'm gonna make a tent. Let's hear. Mother of God. He is like really cold. He is frozen. Oh my God, look at. He's used them so much.
So we know our patient's an overdose.
He's used them all.
Because this guy's used every vein in his body to use drugs.
Do you want to give him my intranasal Narcan or
I
no?
don't want to wake him up that much. He's breathing still, isn't he?
And what you don't want to do is give him so much Narcan that you wake him up completely. Because when you wake him up completely, they have a tendency to want to fight.
He's used everything. See his feet. I think he's even using his feet.
Can't get it to advance at all. Can you turn on the...
Turn it on?
Yeah, see if it runs.
Yeah, you're running, buddy.
Oh, sweet. I got it.
We'll give him some Narcan. I just want him to breathe, but I don't want to
I think
wake him
he's
up.
down to about 8 right now. The
8?
patient's no longer breathing adequately, so we need to push a little bit of Narcan.
Everything's...
Oh, here we are.
Oh,
We're
we're alive.
waking up.
Look at that.
As soon as the Narcan hits, patient pops right back to life.
That works so beautifully.
When you give Narcan, it has the ability to push the drug out, and then your respiratory effort comes back.
Okay, thank you. Yep. 29.9 temperature is very low. Anything below 30 is pretty dangerous. This gentleman is very lucky. If the bystanders wouldn't have called in that they had seen him, he likely would have been dead by morning.
Is the headache on? You got a headache?
Feels like something smashed me inside of my head.
Regarding our stroke patient from earlier this evening. Hey guys, who found him? What time was that?
15 minutes ago.
Okay, he's made a full recovery, but states that his childhood stutter has come back. He does have some left-sided weakness now, but he's happy for his new lease on life.
So you have pain in your belly right now? How long have you been feeling like this for?
2 o'clock yesterday.
For the patient we treated with the GI bleed,
That's something else.
he was transported to hospital, he was treated, and admitted for further evaluation.
When was your last drink?
20 seconds ago.
The patient we responded to earlier in the night with the severe alcoholism
Have you been going to meetings?
That doesn't, I don't need that.
still regularly calls us and still struggles with the same addiction problems.
Okay, let's sit you down on that green thing.
Take your coat off.
Regarding the hypothermic overdose